Hello, everyone. Thank you. Just want to say thanks to Gorkana and Cision as well. This is a great opportunity to share a little bit of what we do. How many of you heard of the Cleveland Clinic? Oh, wow, a lot. How many of you ever worked for a heart surgeon? See? Okay. So that adds a little color to my story here. So I will move this along here. So this is my home, away from home, and I spend a lot of time here. So I run the communications office for the Cleveland Clinic, and we receive about between 500 and 600 media calls a week. So a very busy international media operation. We do novel innovation surgeries, first of its kind. We did the first face transplant in the United States. And so we're really a go-to source for the media. I'm not going to focus as much on social media or internal communications. We also do a lot of metrics around there, but just wanted to be able to share an example with you about our measurement journey and kind of where we came from. A little bit about the Cleveland Clinic. We have soon to be over 50,000 employees. We're in the process of acquiring another health system in Ohio, making us the largest employer in the state and the largest provider of Medicaid services as well, and very active in the Northeast Ohio area. We have 8 community hospitals, family health and surgical centers throughout Northeast Ohio that bring outpatient care closer to home, and our growing international operations are making us more of a global organization. And for healthcare, that's been an interesting experience because we just opened Cleveland Clinic Abu Dhabi in the United Arab Emirates, and that was really the first of its kind that a U.S. healthcare system opened a facility to that magnitude in another country, especially in the Middle East, where they're really building their healthcare system. So one of the questions I ask my team, and just to back up a little bit, I've never been asked to really measure PR. I mean, physicians are very focused on evidence-based, they like data, but they've always said, wow, those PR stories are so great, very compelling. But it was our team that said, we want to be demonstrating what is the value of PR on the bottom line. And we went through some cost-cutting measures last year, cut $330 million out of our budget, and I was asked to cut 70% of my budget. And I started to think if we weren't measuring, we wouldn't be able to maintain it. So not only after I shared and have been ongoing sharing our metrics on public relations and the impact on the organization, not only did I not have to cut, but they actually added to my budget. So this is really important for us. So we look at, do we drive patient volume, create national awareness? Public relations efforts are the driving source of national awareness in the United States for Cleveland Clinic. So we take that pretty seriously and want to make sure that we maintain that level because we don't have a huge advertising budget. We also want to engage the public and the media and really demonstrate the value and really educate our leaders about PR and how does it work and why is it important. I was asked to talk about the old way. So about 3 years ago, we started our measurement journey. Do not laugh. This is how Cleveland felt when I was trying to look at the old way. I've been shamed by my AMAC colleagues and Gorkana and Ketchum that you're not allowed to talk about add value anymore. So when they said, what is the old way that you used to do it? Because we really didn't measure very well. And so I Googled sad faces, and this is what came up, and I thought it was kind of relevant. So anyway, we looked at impressions, we looked at local versus national, really focused on quantity, but the quantity of stories were there, but we weren't moving the needle on awareness. And I won't say the last bullet out loud. The new way, so now we score each of our stories. We really look at an algorithm. We score them from -100 to +100. We try to own the story, really be in depth, because through a lot of research that we've done, we realize that the more people know about the Cleveland Clinic, the more likely they're willing to travel, get on a plane, and come for care. So they travel for transplants, they travel for heart care, they travel for certain cancers, complex digestive diseases, and a couple others. So we really wanted to focus our PR efforts on getting people to get on a plane and travel to Cleveland for care. So we really focus on scoring and the quality of the story, and we also look at sort of the golden egg and how do we really make sure that we focus on that, although quantity is still important because we want to serve all of the media markets that are so important to us. When we talk about charting the course, Barcelona principles, It's been a really important factor as we built our measurement program, understanding what works and what doesn't. Getting the right partners, Arturo said it very well, we can't do it alone. We have an internal analyst and we have a marketing group that does metrics and analytics, but we need so much more than that. And we also use Ketchum, and Dr. Rocklin and his team have been very helpful in providing that oversight and that direction and helping us understand it. At the same time, Gorkana has been terrific in helping us really build the dashboards and build the data that shows us the insights that are so important to helping us drive strategy. Setting goals and measuring the outcomes, focusing on the business results. I mean, most PR people really know what we do is important, but we don't know why. And I think we need to really start making measurement mainstream and asking the question why. Focusing on the quality and the quality, the quantity and the quality, both are important. Leveraging all of our internal assets. You've heard owned, earned, and paid. We have limited dollars for paid advertising. We're not GE. We can't cover the earth in advertising, but we really do focus on targeted advertising efforts and our internal communication strategies and our blogs and social media, of course. I think, if I just look at sort of the elements of our program in general, I mean, we started with nothing, and we really looked at reputation. Our company did a lot of brand reputation and awareness reputation, but not really reputation research. So we've been starting that annually to sort of benchmark where we are, where we want to go, and then really look at why would people travel for care. I mentioned that earlier, but that's important research for us because we really want to target the right message to the right audience and the right geographical location. And we also found through some research that if you asked 10 different stakeholders about Johns Hopkins, you would get the same answer about what people knew about Johns Hopkins. If you interviewed 10 stakeholders about the Mayo Clinic, you would get the same answers. When you surveyed the stakeholders about the Cleveland Clinic, you would get 10 different answers. So we realized we weren't doing a very good job telling a consistent story to our stakeholders. So we developed the Cleveland Clinic narrative that was developed in-house with our partners at Ketchum to really understand, what differentiates us, how do we tell our story so we're a little bit more consistent. And then we look at all the research and the insights from the coverage and what's different, what's working, what's not, and how do we shape our strategy and our creative around that. The monitoring and analysis, we also have partnered with our marketing department. In the past, we've been a little bit more competitive with each other, and I think coming together and integrating with them has been very important for us. And we're in the process of building a database warehouse that is going to correlate in real time what activity is going on, whether it's marketing, PR, or advertising, and then what's happening with patient visits and patient volume at the same time. And I wanted to share a quick example. You don't have to look at any of the words on here, but we did, this campaign was called March 4th, and it was about building awareness for cancer, colon cancer. And so we came up with a screening tool, and we did a PR campaign around, download this screening tool and assess your risk for colon cancer. And the numbers up on the side are up in the 350s, up to 450, but every time, so the first big spike is March 4th when we launched the campaign, and all the other spikes are exactly when we had a lot of media coverage. And the blue and green line along the bottom are sort of our normal course of coverage when we don't have a big PR campaign. What was interesting is you never know when you're going to need health care. It's not like when you go buy something, you can track that purchase right there. Healthcare, you might see something and you don't know if you're going to develop cancer, or you don't know if you're going to need heart surgery, and it's unpredictable. So what we did is we had all of the data from these downloaded risk assessment tools, and we looked a year later, and the blue line across is the patient revenue that actually translated right directly back to the PR campaign, which was really important, and it's something that we never really were able to look at before. Our measurement has been more anecdotal, where we know a story is going to be really big, and we'll call the call center, and we'll have them track the phone calls that come in, and we'll call the Neurological Institute if we have a story that's coming out, and we know that thousands of phone calls come in from our stories, but we don't know then what happens to them once the database that we're building is going to be able to allow us to track the revenue that's associated directly with the PR campaigns, which is important. So this was a month campaign that generated about 1,292 leads. Overall leads, 396 were specifically tied to PR. 36 actual new patients came in. This was a year later. We were able to track what actual patients came in for an appointment. And I wish the number was higher, but 85,000 for an effort that really didn't cost us any money. It was a really good win, and it showed that these kind of coordinated efforts are really beneficial to the organization. And Gorkana has been terrific because they look at the coverage and analyze it for us and help us understand what worked and what didn't, and when they can track our target markets, our target messages, are we hitting the right places and the right media, because we know from our research that those folks are more willing to travel the more they know about the Cleveland Clinic living in these areas. And then back to LeBron, sorry. So this was, someone on our team came up with this idea. Cleveland Clinic, or I'm sorry, Cleveland was the big theme was we're all in. No matter what, we're all in. You guys probably remember if you're a basketball fan. So we came up with these little onesies for the babies that were born, throughout the week, and it said born all in, go Cavs. And it made national media. It just went crazy, and it was LeBron. And so we just got a ton of coverage, and our CEO was getting ready to be interviewed by, I think it was Maria Bartiromo. And we usually work with the producers to find out what they want to interview him about. And this is our chief executive officer, and she said, well, the first thing I want to talk about is the onesies. And I remember he looked over at me and he said, what is a onesie? So, but that was the big spike there on June 7th was all about the onesies. So it was, but the insight from this is that when we do have a creative campaign tied to a medical message, tied to some kind of celebrity or sports event, we usually get a lot of coverage on that. And then just to wrap up here, our measurement achievements for our organization have been, very helpful as a leader of the department to really make sure that our leaders value and appreciate what we do. So I think measurement done right is really important, and I think Arturo said it well. Fail fast, fail soon, and try to fix it. I think learning from others is very helpful, and our colleagues, we talk all the time about measurement and what we could do better, sharing best practices. The research and the insights really help because insights are hard to understand what they are and how to get them, and I think it took us a while to figure out what is an insight, and that's where help from you is really important. But it really helps us divide, change our strategy and make sure that we're doing the right thing. For us in PR, especially in healthcare, it's important to have some kind of call to action because we're not selling things through advertising. It's really important that we capture that information from potential patients. Focus on outcomes, not just the outputs, the quantity versus the quality, and really partner with a strong team, and that's what we've really done. Sorry, I guess I wasn't on the right slide. Okay, so thank you.